Hello everyone and welcome back to Neethu Nursing Insight. In today's video, we are going to learn about one of the most important skills for nurses, how to perform a 12-lead ECG or electrocardiogram. We will cover what a 12-lead ECG is, the equipment required, the correct electrode placement, the step-by-step procedure, common mistakes to avoid and important nursing responsibilities. So let's get started. What is a 12-lead ECG? A 12-lead ECG is a quick, painless test that records the electrical activity of the heart. Even though we call it a 12-lead ECG, we actually use 10 physical electrodes placed on the patient's limbs and chest. These 10 electrodes generate 12 different electrical waves or leads of the heart. A 12-lead ECG is commonly performed to assess heart rate and rhythm, conduction abnormalities, ischemia, myocardial infarction and other cardiac conditions. Please remember this video is only for intended as a standard nursing educational guide. Always follow your hospital's ECG equipment instructions, policies and local clinical protocols. Equipment required. Before starting the procedure, make sure you have all the necessary equipment. You will need an ECG machine, 10 disposable ECG electrodes, lead wires or ECG cables, alcohol wipes or appropriate skin preparation supplies, a razor or clipper if excessive hair interferes with electrode contact, gloves when indicated, a patient sheet or gown to maintain privacy, a paper towel or clean towel to dry the skin if needed. Once everything is ready, we can begin the procedure. Step 1. Verify the ECG order. First, verify the ECG order. Check the patient's name, the indication for the ECG, the type of ECG requested and any specific instructions. If the patient is presenting with an emergency condition such as chest pain, do not unnecessarily delay obtaining the ECG. Step 2. Identify the patients. Next, correctly identify the patient according to your facility's policy. Usually, this involves using 2 patient identifiers. Never skip this step. Step 3. Explain the procedure. Explain the procedure to the patient in simple language. You can say, I am going to perform an ECG. It records the electrical activity of your heart. The procedure is painless and will only take a few minutes. Provide privacy and encourage the patient to cooperate by remaining relaxed and still during the recording. Step 4. Perform hand hygiene. Perform hand hygiene before preparing the patient and equipment. Apply gloves if they are required according to the clinical situation or your facility's policy. Step 5. Position the patient. Position the patient comfortably, usually in a supine position, with the arms relaxed at the sides and the legs supported. Ask the patient to relax, remain still, avoid talking and breathe normally. Movement, muscle activity and talking can create artifact when may interfere with the ECG tracing. Step 6. Prepare the skin. Good skin preparation is very important for obtaining a clear ECG tracing. Check the electrodes sites for sweat, oil, lotion, moisture, excessive hair. Clean the skin according to your equipment and facility instructions and allow it to dry completely. If excessive hair prevents good electrode contact, clip the hair when necessary following your facility's practice. Avoid placing electrodes over wounds, irritated skin or areas where proper contact cannot be achieved. Step 7. Apply the 10 electrodes. Now we are ready to apply the electrodes. A standard 12-lead ECG uses 10 electrodes. 4 limb electrodes, right arm, left arm, right leg, left leg. Right arm RA, left arm LA, right leg RL, left leg LL. And 6 chest electrodes. V1, V2, V3, V4, V5, V6. Remember, 10 electrodes produce 12 leads ECG. Now let's look carefully at the chest lead placement because this is one of the most important parts of performing an accurate ECG. Correct chest lead placement. V1 place 1 in the 4th intercostal space at the right sternal border. V2. Place V2 in the 4th intercostal space at the left sternal border. V3. Place V3 midway between V2 and V4. V4. Place V4 in the 5th intercostal space at the left midclavicular line. V5. Place V5 on the left anterior axillary line at the same horizontal level as V4. V6. Place V6 on the left mid-axillary line also at the same horizontal level as V4 and V5. Important placement rule. Remember this important rule. V4, V5 and V6 should be horizontally aligned. Do not simply place V5 and V6 according to the appearance of the chest. Identify the correct anatomical landmarks. Incorrect chest lead placement can significantly change the appearance of the ECG and may lead to an inaccurate interpretation. Step 8. Attach the lead wires. Next, connect the lead wires to the appropriate electrodes. Check that each lead is connected correctly. The electrodes are firmly attached. The cables are not pulling on the electrodes. There are no loose connections. Incorrect lead placement or loose connections can produce an ECG that looks abnormal even when the patient's actual cardiac activity has not changed. Step 9. Enter patient information. If your ECG machine requires patient information, enter all required details carefully. Check the patient's identification, date, time and any other required information. Always double check this information before recording the ECG. Incorrect patient information can result in the ECG being attributed to the wrong patient. Step 10. Ask the patient to remain still. Before recording, tell the patient, please relax, remain still and avoid talking while the ECG is being recorded. Make sure the patient is comfortable and avoid unnecessary movement. Step 11. Record the ECG. Now start the ECG recording according to the manufacturer's instructions. While the ECG is being recorded, observe the tracing. Look for excessive artifact, baseline wandering, electrical interference, loose electrodes, poor skin contact and any other technical problems. If significant artifact is present, identify and correct the cause before repeating the ECG if necessary. Step 12. Check the ECG before removing the electrodes. This is an important step. Do not immediately remove the electrodes just because the machine has printed the ECG. First check that all leads have been recorded, the tracing is readable, there is minimal artifact, the patient information is correct, the electrode placement was correct. If there is significant artifact or questionable electrode placement, correct the problem and obtain another ECG when appropriate. Step 13. Remove the electrodes. Once the ECG is complete, gently remove the electrodes. Inspect the patient's skin and clean away any remaining gel or adhesive if necessary. Help the patient return to a comfortable position. Dispose of single-use supplies appropriately and perform hand hygiene. Nursing responsibilities. Assess and report. Performing the ECG is only one part of the nurse's responsibility. Always assess the patient and pay attention to concerning symptoms such as chest pain, shortness of breath, syncope, severe dizziness, palpitations, or signs of hemodynamic instability. The ECG should be reviewed promptly by an appropriate qualified clinician according to your hospital protocol. If the patient is symptomatic or unstable, assess the patient first and activate the appropriate emergency response. Do not delay urgent treatment while waiting for routine ECG processing. Common ECG errors to avoid. Let's quickly review some common mistakes. Error 1. Incorrect V1 and V2 placement. One of the most common mistakes is placing V1 and V2 too high. Remember, V1 and V2 are placed in the 4th intercostal space. Error 2. Incorrect V4 placement. V4 should be placed in the 5th intercostal space, left midclavicular line. Error 3. V5 and V6 are not aligned with the V4. Remember, V4, V5 and V6 should be at the same horizontal level. Error 4. Placing electrodes over clothing. ECG electrodes must have proper contact with the patient's skin. Error 5. Recording while the patient is talking or moving. Movement and muscles activity can create artifact and affect the quality of the tracing. Error 6. Applying electrodes to wet or oily skin. Poor skin contact can result in a poor quality ECG. Error 7. Ignoring artifact. If an ECG looks unusual, don't immediately assume that it represents a cardiac abnormality. First, consider possible technical problems such as electrode placement, poor contact movement, or electrical interference. Easy way to remember the ECG procedure. For nurses, you can remember the basic sequences as order, identify, explain, position, prepare the skin, place 10 electrodes, connect the leads, record, check, report, document. Following these steps will help you perform a 12-lead ECG safely and accurately. Key messages. The quality of a 12-lead ECG depends on 3 important things: correct patient preparation, accurate electrode placement, and minimal artifact. And as nurses, we should also recognize and promptly report significant clinical findings. Most importantly, take extra care with the chest lead placement, especially V1 through V6, because incorrect placement can affect the ECG appearance and potentially lead to incorrect clinical conclusions. I hope this video helps you perform a 12-lead ECG with greater confidence. In my next video, we will discuss basic ECG interpretation, which is another important skill for nurses. If you found this video helpful, please like the video, subscribe to Neethu Nursing Insight, and turn on the notification bell so you don't miss the next lesson. Thank you so much for watching. Keep learning, keep caring, and keep inspiring. Take care, stay safe, and I will see you in the next video.